Hi, everyone. This is Dr. Isabelle Amigues, your friendly rheumatologist. And we are here with another live. And let me just go on Instagram as well. Yeah, perfect. So, another live. If you are watching this as a replay, which is totally possible since I'm doing this 1 hour earlier than usual, please write hashtag replay. And without further ado, I'm responding to a question from one comment, and we're going to go very practical today. So the question is, I have joint pain, and I also feel like I'm being run like by a bus. That I also feel I have like the flu. I have pain all over. Why is that? And we're going to go into what that can be and why you can have this and what you can do to help with this. Okay. So for those of you who do not know me, I'm Dr. Isabelle Amigues. I'm a rheumatologist that's double certified in internal medicine and rheumatology. I have a French accent because I am actually indeed French. Live in the US in Denver, Colorado. And I've done a training in France before and did a rheumatology residency and fellowship, and then moved to the US in New York City, where I repeated my residency and then fellowship at Columbia University. And then after a while, moved to Denver, where I was at National Jewish, did a lot of work in interstitial lung disease, and then ultimately was fed up with the insurance system and opened my own direct care practice where really I work for my patients. And then, of course, we deal with insurance for any medication, any labs, any x-rays and imaging. But really, my patients, I work for my patients, so they pay me, right? And those are educational content. Again, this is not medical advice. It's really educational content. And so a question that was asked was, look, I have joint pain and I feel like I have the flu. Why? Why do I feel like I have the flu? And so we have to always question what type of joint pain and what's going on, right? So as a physician, you're always wondering, you're always thinking, what can this be? And you want to be unifying. But before you're unifying and putting all the pieces together, you want to take a broad view of what is going on. So in this case, so you have joint pain. What type of joint pain is it? Is it joint pain that's worse in the morning? Is it joint pain that's associated with swelling, that's associated with morning stiffness, when you feel like you have to move your hands, move your body before it starts the day, maybe for more than 31 hour, 30 minutes an hour, maybe sometimes 2 or 3 hours, right? Is the pain worse in the morning? Is the pain improved with exercise? All of those questions are saying this is inflammatory. And when you have an inflammatory arthritis, then it like we're thinking, what can this be due to, right? If you are feeling like you have the flu, that means that there is a systemic inflammation. So if you're really thinking about this, when you have a virus like the flu that comes into your body, your immune system is doing exactly what it needs to do, which is it's creating inflammation to get rid of what needs to be getting rid of, right? So you have a pathogen, the flu, the virus that comes in, and you are trying to get rid of it. And the only way that the body has to get rid of anything that's wrong is by creating inflammation. So it's not that inflammation is not good, it's that you don't want inflammation constant. And so in the case of flu, right? In the case of flu, when you're feeling the fever, when you're feeling the pain all over the body, the muscle pain, the joint pain sometimes, that's due to the flu, what's happening is that your body is reacting to the virus. And it's going to react more if it's never been like if it's never seen the virus, that it's going to react if when it's already seen the virus. Why? Because that's absolutely normal. You want to do that. You want to have a very strong reaction to something that you don't know, versus you already have created antibodies. So you're only creating a small reaction if you've already known the virus, right? So that's just to get you situated of why you're feeling pain, why you're feeling inflamed, why like when everyone has had some sort of flu at one point, right? And so you're not feeling good, but the not feeling good is actually your body doing what it needs to do to get rid of the infection. I'm just going to stay there for one more minute, which is, you remember when there was COVID, there were some young people that still got affected and actually had really bad outcome. That is because in some patients, there was too much reaction. And so it almost like the immune system got overloaded and overloaded the body with too much inflammation. So too much inflammation is definitely not good for us and can actually technically cause a lot of harm. It can shut our organs and so on. So it's really a balance of how much inflammation you want and how much you need, right? Like and to, like, not too much, not too little, right? If you have too little, you don't get rid of what you don't want to have. If you have too much, you can actually cause harm to your body. Okay, so that's something that I think is really important for us to understand, right? Because inflammation is what, as a rheumatologist, I deal with. So when you have an inflammatory arthritis, so worse in the morning, associated with morning stiffness, associated with swelling, gets better with exercise, and that we are going to look at other symptoms. Do you have any other symptoms than I feel like I have the flu? Do you have muscle weakness? Do you have any skin rashes? Do you have any hair loss in patches? Do you have any Raynaud's phenomenon where your hands turn white in the cold or change of temperature? Do you have any shortness of breath, chest pain, etc.? So we're looking at all of those other symptoms that you have. We put this and we make a map and we're like, okay, now let's see how it fits together, right? So if you just have joint pain and that there's swelling of the joint and that it's very inflammatory and that you have nothing else than this feeling of, I feel like I have the flu, but you actually don't have fever, you actually, then our thought is, could this be rheumatoid arthritis? Could this be gout? Could this be pseudo gout? Could this be lupus? I don't know, right? So you're looking at all of this and then you're doing blood work, you're examining the patient, of course, then you're doing blood work to see, okay, what is this? Now, if you have infection, like if you have a fever, then we need to make sure that this is not infectious. So there are, infection that can actually last a long time and can cause joint pain. So some of the common one, any sort of virus, like really, like if the flu can give you joint pain. You can also have, how do you call that? Diarrhea, if you are eating and you get infected, and you can actually have issues from the guts that is infected that can cause joint pain. You can also have a reaction to that. So it can be either directly related to the infection, or it can be secondary to the immune reaction to the infection. That's called Reiter syndrome or reactive arthritis. As the name says, it's reactive. Okay. Or you can have, so we talked about infection, so it can be bacterial, viral. I haven't really seen parasite cause that, so that's something. But there are multiple infections that can do that. And so that's the first thing, is that if you have fevers, if you have sweating at night, if you've lost weight for a little bit, and if you really like this happen, like from one day to another, and did the joint pain, is the joint pain all together? Is this just an infection? So we are always going to have to rule that out. If it's been 6 months that you have this, or like it's over that, or 2 months, 3 months that you have those symptoms, then you're more likely to have a chronic inflammatory arthritis. So we're more thinking of rheumatoid arthritis, psoriatic arthritis, and so on. And so that's when you're actually worry, like you're basically thinking, okay, is this just first an inflammatory condition? So it's not infectious, it's an inflammatory condition, and why, right? And the why is that those, as their names say, those inflammatory conditions, they cause inflammation. And so when you're feeling this feeling that you've been run by a bus or that you have the flu, it's nothing else than the inflammation, except that instead of being useful for your body, it's not. And it's causing issues. And so that's what our drugs are here to help. I would say If you're really looking at it from a bird's view, I would say that in general, as long as you've taken care of the infection, sometimes you can actually decrease the inflammatory reaction, and that will make you feel better. So really what the idea is how do we make sure that your body is in balance when it turns to inflammation? How much is too much? And if you're really looking at this, you would actually realize, and for those who are interested, you would realize that, for example, when we had the COVID pandemics, and that a lot of people would have those very inflammatory responses to COVID, the treatment was literally using this, and it is still using treatment that in rheumatology we use. So a lot of steroids, a lot of biologics that are inhibiting the cytokines, which are IL-1, IL-6, TNF, Jack. We know, and it is actually really well studied, that those actually can really help with this super inflammatory process. And so in general, what I would say is, unless you have contraindication, take some anti-inflammatory like ibuprofen, Advil. Again, this is not medical advice, but it's something to consider, right? And see how you're doing, because that might be something that can really help you. Tylenol or paracetamol in Europe won't really help when there is inflammation, because that's not the mechanism of action. But ibuprofen, Advil, Aleve, any sort of non-steroidal anti-inflammatory drugs will help. Steroids can also help, definitely helps. The question is like, how much is too much, right? So I personally don't like steroids, because if you have an inflammatory condition, you start relying on that, and we don't want you to rely on steroids. So we want you to be in perfect balance with the least amount of medication, the medication that's going to cause the less harm. Okay, but basically, just remember to like wrap this up. The feeling of I feel like I have the flu is normal. We have a squirrel here. The feeling of having the flu is absolutely normal when it comes to having an inflammatory condition, because that is what your body does. Okay, and we need to calm it down. And that's why meditation, visualization, affirmations, they actually work. Eating an anti-inflammatory diet, that also works. And by the way, an anti-inflammatory diet might just be a whole food plant-based, like a ton of veggies. That is anti-inflammatory, a ton of green veggie, green, red, yellow veggies. That really helps. And so I think you will notice now, when you have this, you can actually pay attention to, how do I feel? What's going on? Sleeping can help with inflammation and things like that. And that's why usually we're very tired when we have an infection, is because our body is inflamed to get rid of the infection. And so sleeping is a very good way of healing, because then you have more space and more opportunities to heal. Okay, so I hope this was helpful. I'm going to plug in a book that I was a writer on just now. So it's called Made for More. If you're interested in seeing a group of physicians who decided to change their way of practicing in very different areas, it's called Made for More 2. There was a first book, and then there's a second one. It just launched today. It's available on Amazon, everywhere, on all the platforms. And it's most likely going to be a bestseller, because the Made for More one was a bestseller. So I don't see why this one would not be a bestseller. And you're gonna enjoy it if you want to see how physicians like me decided to choose a different way and how they are doing this. And if you have physicians, I think that that's actually how to give hope to physicians. If you have physicians that you would like to change a little bit how they are seeing things, so look into it. It's called Made for More 2, and it's available on Amazon. And I have put posts on social media, so you can look. And then it's always a pleasure. So I'm saying hi to Denise, 2202, Mary Belize. I'm sure Rock Dog will be there. And I have some other people here, but I don't see your name, so it's not possible to say hi. If you're watching this as a replay, hashtag replay. And then please subscribe on the YouTube channel. It's under Rheumatology 101 by Dr. Isabelle Amigues, Amigues. It's been a pleasure. Have a wonderful week. See you next week. Bye-bye.